ready to get started. Tonight's topic, very important. A lot of times you'll notice our topics are very focused specifically on how to work and deal with the little ones, with our children or those in our care. Tonight, we're going to talk more about parents specifically. So new parents in mental health, really all parents in mental health. So I'm excited to introduce to you tonight's expert is Dr. Clara Laura Ospina. Thank you for coming. We're welcome. We're so glad you're here. I'm going to tell you a little bit about her. She's the director of the Psychology Internship Training Program and the clinical director of the Adult Outpatient Center for Behavioral Medicine. And her areas of interest include PTSD and other anxiety-related disorders, depression, marital discord, bereavement, adjustment to loss, issues pertaining to difficulty with infertility, chronic pain, end-of-life issues, as well as situational stressors. So a big, wide scope of expertise that she brings with us tonight. And she's also fully bilingual and has interest in facilitating groups in relaxation skills, anger management, pain management, and mindfulness. And she also conducts counseling and psychotherapy using various therapeutic models and approaches, including the psychodynamic, cognitive behavioral, existential, and family systems. So we're going to learn, I think, more about all of that tonight. And I'm so excited to have her join us. So Dr. Laura Ospina, welcome.
Thank you so much. Thank you for having me again. It's always wonderful to be on this show with you, Sierra.
Well, I'm excited because we have met together before. And I will say, those of you who are listening, if you don't know, visit jacksonevents.org. You can go back to our archives, and there are literally dozens of parental guidance episodes. You can go back and listen to the one that Dr. Laura Ospina and I did in the past. And then this one will actually be available to you there as well. Give us about a week just to get it up there. But if you're on the email list, you'll get the email so you can forward this to a friend or have it for your future reference. But jacksonevents.org, you can access all of the archives. So, all right, let's get started. We're going to dive right in. And if at any point, those of you listening have a question for our expert, you can use that Q&A feature in the bottom of your screen. Just click that, type your question, and I will do my best to get it right here in front of our expert. So super thankful for all of you joining us. So let's get started. Let's start by talking about the difference between baby blues and then a postnatal depression.
Yeah. So, it is expected that there's going to be some kind of mood changes when you first come home with the baby. And kind of the average amount of time that our mood, you may have low mood, you may start feeling heightened anxiety, 3 to 5 days. And this is when you bring the baby home, because for most of us, we get to stay in the hospital a couple of days, and that feels very safe because there's a lot of people around us. Everybody's coming to visit. You're not ever really quite alone with the baby, and there's a lot of support. And so I personally kind of start counting those days, when you bring the baby home, and now it's just
your own, yeah.
you and your partner, right? Or you by yourself, and you're kind of taking care of everything, and having to make decisions and things like that. So about a week, if you're kind of adjusting to the mood for about a week, that's pretty average.
Okay.
We would start worrying about depression if we're looking at about 2 weeks. If you're looking at anything between 2 weeks and certainly 4 weeks, right? If we're into a month now where you are just not feeling yourself, you're feeling like you're not bonding with your baby, you're feeling despondent, you're either sleeping too much or not sleeping enough. And we'll talk a little bit about not sleeping enough, because some of that is expected.
Yeah.
But the signs are really, you're feeling almost like you are watching something happening and you're not a part of it, or you don't feel like you want to be a part of it, or you don't feel like you know how to be a part of it. So it's a little bit of this detachment. That is concerning. And that is when you want to talk to, whether it's a lot of my clients, my patients that have postpartum depression don't come to me directly themselves with postpartum depression. They actually come through their OB. And so when you are going, for that for that, 3-day visit, that,
Mhm.
4-week visit, speak with your doctor, and your doctor might actually notice something. And oftentimes, again, I do get referrals directly from the OBs because they notice
Yeah.
they know what to look for. Um,
Right.
we talk
Right.
enough that they know what to look for. So, you know, if between 2 weeks and a month you're feeling low mood for most days than not, you're
Mm.
feeling detached, you're having a hard time um, um, bonding with your baby, maybe you're more irritable than usual
Mm.
with
Mhm.
people around you. These are some of the signs that you may be, kind of heading towards a postpartum depression. And don't wait too long. If you
Yeah.
are feeling these things, tell somebody. Tell one of your medical professionals, whether it's your primary care, your baby's pediatrician, or your OB. And if you
Mhm.
have a mental health practitioner already, then talk to them about it.
That's great. That's great advice. And I know my OB has like a poster on the back of the bathroom door. And so always going in, I'm like, I read the poster every time going, okay, do like a little mental
Yeah,
checklist,
yeah, definitely.
which is so good and helpful. But like what you said, just having those conversations sooner than later, I'm
Yeah,
sure
yeah.
is always best. Let's talk shifting gears a little bit to, kind of hear about depression. Then you kind of hear I don't know if it's the same side of another coin, but I hear about anxiety. And so talk to
Right.
us about what's normal anxiety versus like problematic anxiety as a new parent.
Yeah. So again, a normal anxiety, a lot of it has to do with the length of time, right? And
Mhm.
how much it is impacting your ability to do the things that you need to do, right? Your ability to continue to live your life. Because the fact that you had a baby does not mean that your life is completely different.
Right.
Although a lot of things will have changed,
Yeah.
but so normal anxiety, or average, I hate to use the word normal, but there's kind of no other way to use, other word really that describes it, but like the anxiety that we would expect to have as a new parent is the, oh, this is the first time I do this and I'm not really sure how I'm going to do that, and how do I,
Mhm.
just the questions that are going to come up with the everyday little challenges that come up. Problematic anxiety starts looking like a parent that doesn't want anybody to be near their child, visit the home, where anything that was routine before the child came to your home is now not
Mm.
part of
Mm.
your routine at all.
Mhm. Mhm.
Everything has to be different, right?
Yeah.
Nobody can, the not getting near the baby, the not being able to sleep, the, in some of the anxieties that are natural, like the whole, is the baby breathing? You know,
Right.
I don't know. How is the baby, am I holding a mirror to the baby? Are we looking at the belly? All these little tricks that
Right.
people try to learn. But if you start thinking all the time, right? I must check on my baby all the time.
Mhm.
I,
Mhm.
I can't sleep because I have to be watching my baby all the time. Nobody can hold my baby except me. Not even dad can hold the baby because
Mm.
nobody's going
Mm.
to do it right. Nobody
Right.
can feed the baby except me. No,
Right.
I can't sleep because something's going to happen to the baby. Uh,
Hmm.
Something
Mhm.
that's actually common, but people don't really talk about, is that sometimes we start to get really morbid thoughts
Mhm.
that horrible things are going to happen to our babies, and
Right.
and that's because we feel very hopeless. We're very attached to this little creature, and
Mhm.
we do realize that this little baby, has it relies on us for everything, and it all of a sudden does become kind of the most important thing in our lives. And so there's this enormous fear already of anything potentially harmful befalling the baby. And so what ends up happening is when that becomes overwhelming, then parents actually can start to have kind of a pseudo hallucination or pseudo delusion that they're the ones that are going to cause harm to the baby. And so that can then cause parents to retract from the baby, because they don't want to be the ones that harm the baby. And then we begin with a kind of a postpartum or a lack of bonding. So it can be a really, so if you're ever having feelings like you're going to cause harm to your baby, or excessive feelings of worry that you would not have thought you would have had before, again,
Mhm.
talk to somebody. It's challenging. It's difficult to explain what's too much anxiety, but I'm
Right.
going to say this, and it's a little delicate. If other people are noticing, and if other people are saying to you,
Mhm.
"Hey, it seems like you're a little bit over anxious," or "Hey, it seems like it's going a little bit
Mhm.
overboard," instead of getting defensive, try to be open to
Mm, that's
seeing
good.
that.
Yeah.
because as new parents, we often get defensive, like this is my way and this is how I do things.
Yeah.
But it's other people's eyes that sometimes can help us see what we can't see.
Right. That's right. That's good. Yeah. I feel like I remember too with my first baby, like all of a sudden I can see every danger, potential danger,
Oh
and I'm
my
like,
gosh.
oh,
Oh
I
yeah,
gotta be careful or this will spiral out of control. But the things you never really thought of before, you're like, this could hurt the baby in some way. But yeah, that's
absolutely.
good to be open and not defensive if someone notices something that maybe that's being used to kind of give you a nudge to say, maybe we should look more at this. That's good. Okay, let's talk about bodies postpartum. What happens to our bodies postpartum? That's kind of an open-ended question. So however you want to take
Yeah,
it.
well, so much stuff, right? So much stuff. I mean, we know. So it depends whether your delivery was via cesarean or vaginal delivery. But really, what's happening is our bodies are healing. Our bodies are healing, and so this means that we need to go slow. It doesn't mean we have to come to a full stop, but it does mean that we need to go slowly and at the same time begin to move. So it's kind of a simultaneous careful, careful, deliberate movement.
Mm,
If we're breastfeeding, there's lots of things happening with breastfeeding that can cause issues as well, whether your milk comes in a little late, whether you have lots of it, not enough of it, whether the baby can latch or not latch. It can be painful, it can be easy peasy. You can have lots of supply, not enough supply. So lots of things are happening with your body. Your body's healing. We do have bleeding for a few weeks after we have the baby. That's very normal. If you had an episiotomy, there's going to be pain when you urinate, pain when you go to the bathroom. So much happening. Our hormones are kind of trying to regroup and get kind of back on track, and again, that is all affected by whether you're breastfeeding, not breastfeeding, whether you're sleeping, all of that. One of the best thing that you can do, and people will tell you this, is to try to get sleep, which again is a difficult thing, and we will be talking about this. But the more you can sleep, it will help your body recover.
that's good.
Sleeping helps our bodies recover. It also obviously helps us with the fatigue.
Mhm.
Um, but if you're feeling anything again past the 2 week mark, where you feel like you're still bleeding too much, where you're having a difficult time, well, with breastfeeding, you want to attend to that a little bit earlier. um,
Mhm.
couples often ask, when can I get back into exercising?
Mhm.
When you feel ready. There's no like set time limit, there's no like
Right.
guidebook, right? When you feel ready, but start slow and build yourself up, to
Mhm.
working out. Same with intimacy, right? When can I be
Mhm.
intimate? When you feel ready. There's no right, there's no wrong. When you and your partner feel ready, you can get back to intimacy.
Yeah.
And it's recommended that you get back to intimacy. It is recommended that you get back into a workout routine. It is recommended that you get back to your whatever your routine was pre-birth, pre-delivery, pre-baby, to the
Mhm.
extent that you can.
That's
You don't
good.
want to completely lose yourself
That's right.
in this new
Yeah.
challenge.
Well, one thing we know, this is also good. I had a baby 4 months ago. And so I'm like, oh, this is all, still feels very fresh. So all this is like, oh, this is so good, just personally relevant. But also in parenting, everybody has an opinion. A lot of people want to give advice and a lot of great advice out there and a lot of unsolicited advice that maybe nobody needs at all. So my question would be, what would be your wisdom or advice for someone and how to handle like unsolicited advice as a new parent?
Yeah. And I like to separate that into unsolicited advice from people we know
Mm,
and unsolicited advice from people we don't know, because
mm.
you're going to get both.
Yeah, that's
You
true.
know,
That's good.
and oftentimes I have found, and I don't know, Sierra, I would love to hear from you what your experience is, that sometimes the unsolicited advice from the people that we do know feels more personal. And
Oh
so
yeah,
we take it more personally, and I'm thinking,
totally.
mothers, mother-in-laws, sisters, sister-in-laws,
Hmm.
co-workers, things like that, because it feels like, well, you know me, and because you know me, you ought to know that I'm kind of going to do my best, and I'm
Yeah.
really going to do things my way. And if I had a question, if I wanted to get an opinion, I would ask you for it.
Yeah.
And so my response is to try to say something along those lines, but in your own, kind and kind of thoughtful way. And so really it's, oh, well, thank you for being so thoughtful about, my difficulty breastfeeding. I really appreciate your input. I'll take that
Mhm.
into consideration.
Yeah.
And so something like that, I think is less off-putting than, look, I know what I'm doing. Let me just figure this out.
And you just back off. No, yeah.
Exactly,
That's right.
exactly. And so even with the people, it's, people tell us things because they care about us.
That's right.
Again, especially those people that know us, they care about us and they feel, whatever works for me is probably going to work for her, or this is really difficult. Let me give them, or let me give him, some pointers. And so we don't want to kind of put a hand up like this. We kind of want to say, okay, well, I appreciate that what feels like caring, right? It
Mhm.
feels like you care
Mhm.
for me. And so it feels like you want to help. So I appreciate that you want to help. But I'm okay trying to figure this out on my own.
Yeah.
You know,
Yeah.
and I really like that statement. Like, I'm okay trying to
That's
figure
good.
this out on my own. I really appreciate that. With people you don't know, I really have found, and again, as a new mom myself, I really just found just going, oh, well, thanks for,
Interesting. Yeah.
yeah, yeah, like, oh,
Thanks for sharing
I
that.
oftentimes wouldn't even say anything. I would just go, oh, okay, and just kind of move on. I'm not going to say yes. I'm not going to say no. I'm really not going to
Uh-huh.
engage that much. I'm just, eh, have your own way of doing things. We do want to be open to other people's opinions. This is, if it's our first time, I mean, surely there are things we can learn.
Mhm. Yeah.
But it is also important for other people to know. And again, especially if these are people that are going to be around us quite a
Mhm.
bit and maybe helping us with our children, helping take care of the baby and things like that. That we have our own way of doing things, and that's what we prefer,
Right.
and
That's
that we
good.
don't mind making mistakes. That's the other thing. We
Mhm.
don't mind making mistakes. It's perfectly fine.
That's great. And I love just giving the advice of, I think naturally inside of us, it's like, our insecurity or our need to like defend why we, kind of rises up. And it's like, we don't even have to defend, you just, okay, thanks. Thanks for sharing that. I love that. I think it can just be, boop, that's can be the end of it right there. And file it under wherever you need to file it for later.
Exactly. Exactly. Yeah.
That's good. Well, there might be a mom or dad listening, thinking, man, I would never say this, but I kind of long for the days before the baby, or I feel so different, or, is it normal to feel that or feel like guilt and shame? Like, oh, I'm thinking about life before baby. Like, talk us through that.
Yeah, yeah. It's so common. It's so common because, again, it is such a big addition, right?
Mhm.
It does feel like everything should change. And if we've talked before, but one of the words I despise is this word should. It
Mm.
feels like everything should change. And yet one of the things that I talk to people all the time is, for example, in your partnership, you and your partner were there before the baby.
Yeah.
And so it is so important to leave room for what was there before the baby. And some of them might be longing, like, your time, it has to be split differently.
Mhm.
Your finances, one of the biggest things that people often don't discuss is the financial impact of having a child.
That's right.
It's huge.
Yeah.
You might have had lots of, or you might have had money to go out to dinners and do all these other
Mhm.
things. Traveling's different with a baby. All the things that you would have done as a couple or you would have done on your own are different with a baby. And
Mhm.
so it's
Mhm.
not that we stop doing them, it's that we do them differently.
Yeah.
One of the things that the primary parent often loses out on is time for themselves,
Mhm.
and that, I think, is often the thing that primary parent wants to have the most, which causes the most amount of guilt. Because then it's like, well, what does this mean? Does it mean I don't love my baby? Does it mean I don't
Mm.
want to be with my baby? No, it doesn't mean any of those things.
Right. Does it mean I'm selfish to even think about being away from my baby,
Not at all. And
Yeah.
my favorite definition of selfish is taking care of the self. And
Mm.
we need to take care of ourselves. So, in
Mm.
fact, we do need to think a little selfishly sometimes.
Mm.
That's perfectly fine. So, no, it's perfectly fine to long for those days. But what is even maybe more, since that's not going to happen, um, what is more helpful is to say, okay, how do we integrate the baby
Mhm.
in this kind of fits in with also the anxiety and the, living your life. It's, maybe we do take the baby to the restaurant. Maybe, I do take the baby and put the baby in a stroller and go to the mall and walk around. And so we have to manage, right, that reduction of anxiety, that feeling of, okay, I can do this, and it's okay if the baby cries, and it's okay if people look at me and the baby cries, because the people around me are bothered by the crying baby, well, too bad for them.
Yeah.
Too bad for them.
You were a baby once too, is what I want to say. I want to be like, you cried in public too once.
Yeah, I have to say, as a new mom, one of the things, when the baby would be crying, and I would get looks from other moms, I always wanted to say, please, the one of you who'd never had the crying baby, raise your hand.
Yeah, that's right. That's right.
Oh, goodness. As a not new parent anymore, I like to look at those moms and go,
like,
what? It's like
solidarity.
yes, like, okay, so solidarity.
That's
if
right.
we can all have a little more solidarity, I think that would help reduce some of those feelings of guilt and anxiety.
Yeah, that's right. That's right. And I will say, like, my own crying baby is so different than someone else's crying baby. Someone
That's true.
someone else's crying baby, I'm like, I don't even know that I notice it. I'm like, you're fine, go for it. Yeah, that's interesting. All right, let's talk about deliveries. Okay, this is interesting because I actually had a conversation. This happened to me yesterday. And a lady was just asking me about my deliveries, and I'm an open book, and I was sharing. And then she kind of asked a little bit of a probing question that I wasn't prepared for. And I felt like this tinge of shame. She was like, well, why were you induced? Like, there was something wrong with that, And I was like, and all of a sudden I'm like, all these things rise up, and I'm like, whoa, what made me feel that way? So talk to us about, how do you manage those feelings of shame if maybe your labor or your delivery didn't go as planned, or as other people planned for you to have,
Yeah. Well, I like to work, and this is happening more and more in my field, which I absolutely love. And that is working with moms before they have the baby. And one of the things that, I like to talk about is that whatever you have planned, also plan for that's not going to go that way.
Yeah, that's right.
And
plan to pivot. Yeah.
Yeah, exactly. Right. So the whole kind of expect the unexpected. And so having those conversations, my suggestion is actually that you don't engage in those conversations. Your baby came the way your baby came. There is no standard right way to have a baby. The baby just comes how the baby comes.
That's right.
I have, worked with a lot of moms who feel a lot of feelings, have a lot of feelings when there's an emergency C-section, for example. And it's, I think I missed out on this, or I think, and so we want to look at, so maybe you didn't have this, but maybe there's something else that you gained from it, or that, again, this is how this baby was intended to come. I get kind of spiritual in this realm, and I really like to let parents just focus on the fact that what is important is that the baby is here, and that the baby is healthy, that the baby is safe, that you are healthy, and that you are safe. And how all that happened, right? How all that turned out, it's as it needed to be. Now, there are oftentimes difficulties, right? We do have difficulties during birth, and that can bring on a lot of guilt, and that can bring on a lot of shame for parents as well. And I think it's important, so important, for people around us and for the medical establishment to be able to normalize that things happen. Sometimes things happen and it doesn't go as planned, and everybody does their best to recover. I personally feel it's just best to stay away from conversations with strangers. And so how do you stay away from a conversation with a stranger? How did you deliver? You go, oh, that's an interesting question. Are you interested in deliveries? I put it.
Yeah. Are you an OB/GYN? Is that why you're asking me?
That's a really interesting question. I wonder what curiosity you have about deliveries.
Yeah.
And that kind of indicates to people, I'm not going to talk to you about my delivery.
Right.
Not gonna do it.
Yeah. Oh, that's good. That's great. Yeah, so many things that you're not really prepared for. Nobody tells you this,
I
the things
know.
that people will ask you.
I know.
And then I think of things that I've asked people too, and I'm like, oh, well, I probably have overstepped boundaries before too, just asking. But this is good. A great advice of just how to kindly and graciously handle situations like that. So I appreciate that, Dr. Laura Speedy. You've got a great just insight into interpersonal skills, even too, of course, into your line of work is so important. Okay, let's talk about one thing I love, and I feel like the Latin culture does this so well, but when a woman is pregnant, everybody just shows up, like people just take care of you and open the doors, all the things. But then sometimes, I'm not speaking just to the Latin culture, but in just general, everybody, you're pregnant, they're excited, but then you kind of have the baby, and everyone's excited, but then life eventually goes back to normal. And so what happens when everyone goes back to their normal lives and you're like, my life's just been, rocked because
Yeah.
there's this huge, change, addition. I love how you say addition.
Yeah. And
What advice do you have for a
that
family?
can be that can be, postpartum depression sometimes doesn't happen until that happens,
Right.
till the support, because like you said, I mean, for some people, they're lucky enough that maybe their parent is going to be the regular caregiver, or they, can afford to have somebody come and kind of be a regular caregiver. For some parents, when people leave, they are left on
That's
their
it,
own,
yeah. Mhm.
and that is the moment when the postpartum depression can begin, because the anxiety can raise. Then that happens to be the time when the baby will cry incessantly.
Yeah.
So the most important thing there is people go back to their normal thing because that's what we're supposed to do. We're kind
Right.
of like we're not. I mean, in some cultures, I guess
Right.
the village thing happens.
Right.
But for most of us, people kind of go back to their daily lives. It's okay to call your friends. It's okay to call your mom. It's okay to call your support system. Call on your support system to say,
Mhm.
hey, you know what? I kind of need you to come back today. Or, hey, you know what? I kind of need you to visit. Or, hey, I'm having a really difficult time. And we sometimes feel shame, or we
Yeah.
sometimes feel like we are being a burden if we reach out.
Right.
Because we don't have the option of reaching out to other people who are in our circle, let's say. And so then we have to create a circle. We
Yeah.
cannot do this on our own. It is
Right.
important for you as a new parent, for new moms, and I say new dads because often we forget the new dads.
Mhm.
And new dads need support as well,
Yeah.
because they are also going through this, and they are going through this in different ways than moms are going through this,
Yeah.
because babies bond with dads a little differently than they bond with moms, for all the reasons that we know.
Right.
And so seek to build your new village, right?
That's
This is
good.
going to be your new village. And here's where going to park, right? Going to the
Mhm.
park, if there's a park available, or going to the classes, right? The baby and me classes. You might think I will not be caught dead in one of those classes, but guess what? Those classes are filled with people who are experiencing
And that's
very much what you are
That's
experiencing,
right. That's right.
and so they will be able to be right there with you in the feelings that you might be having, you
That's
know.
good.
So it's a time to build your new community, and that might be a community of one. It might
Yeah.
start with one person that you see in the park every day, or one person that you connect with in one of those classes or those
Mhm.
courses, or a daycare. So don't try to go at it alone.
Yeah.
Don't
Mm.
try to go at it alone, because this can be an isolating experience. It really can be very isolating
That's
if we kind of give into that pull.
that's
So
good.
so try to fight the pull to do it all on your own, and seek community.
You are really speaking my soapbox and passion right now. I will say, even just our heart at Miami Mom Collective, I always say that motherhood is hard. We can't really necessarily take away all the hard, but it doesn't have to be lonely. So, like, together we can shoulder that hard. What feels really hard with one person, we can
Yeah.
give a little of that load to someone else, and it helps relieve some of that. So I just love that you're speaking to that, even just a community of one. So that's just, we're made and crafted and designed, I think, for
Yeah.
relationships. So it can
Yeah.
be easy, like you said, to isolate, but to resist it.
Yeah.
That's
I
great.
mentioned one thing that's a little interesting that I have spoken to other moms about, and it's a little bit about when you find yourself alone.
Yeah.
Talk to your baby. One of the things that is really stark when people leave is that there's silence
Mm,
because you're not speaking with somebody. When people are there, right, when you're visiting with somebody, we're talking about the baby and we're
that's
goo
right.
dying, but oftentimes people leave and so there's this silence, and moms sometimes don't, I mean, I don't even know how to say this, but sometimes we don't talk to our babies, and
Yeah.
it's very healthy to talk to our babies,
Mhm.
because they hear the language. It helps them learn the language, and for us, it helps us to not feel so alone. It helps
Mhm.
us to bond with the baby, but it helps us to not feel so alone. And I mention this only because I'm really surprised, when I have been helping moms with postpartum depression, that the moms with postpartum depression, a large percentage of them are women or parents who have not been speaking to their babies, who have just
Mm,
been being very silent. And it's like
interesting.
kind of my own little, informal uh, research,
Yeah.
that moms who speak to their babies, I think, have less, maybe are less prone to falling into some of those feelings of depression.
Interesting. That's great. That's great advice. Wow. That is really interesting. Talk to your babies,
Yeah,
mamas.
talk to your baby.
That's wonderful. The great thing is, we laugh about women having so many words, and I'm like, hey, we got a chance to get all those words out. No one's going to interrupt us.
Exactly. No one's supposed to be
Talk
quiet,
to
and
those
the
babies.
baby's gonna,
Love
pay
it.
attention to you. Yeah.
Yeah, that's great. That's great. Okay, let's talk about how, and again, those of you who are listening in, if you have a particular question at all for Dr. Laura Ospina, just drop it in the Q&A and I will get it in front of her. But let's talk a little bit now about how having a baby might affect a relationship with our partner.
Yeah.
Because
Well,
obviously it does.
yeah, obviously. I mean, one of the most obvious parts is the physical part, right? The initial physical part, because again, our bodies, it does take our bodies some time to relax, and it takes our minds not relax, but to get back to
Mhm.
fighting shape, if you will. And not just like shape, but like
Right.
inside all the stuff that happens. So
Yeah.
it takes the body some time to recover, and it can take our minds some time to recover, and to begin to see ourselves as like sensual, sexual beings again.
Right.
You do want to be thinking that direction. And sometimes one of the parents now shifts their thinking. I've had a lot of couples that I work with where now, for example, the husband is like, well, you are now the mother of the baby, and so now I see you totally different, and you just had a
Mhm.
baby, nothing just came out of there, and I don't even know how I can get close to that. So
Right.
it's, oftentimes I think women get blamed for the lack of intimacy. It's
Mm.
not so. It's both ends. I,
Both
I
sides
hear
of
it
it.
from both partners. Um, and then there's also the fatigue component.
Mhm.
I the when if it's in heterosexual couples, the dad might be a little jealous that the baby is getting all this time, that the baby is getting
Mhm.
all the attention, that the
Mhm.
baby gets all the physical contact.
Mhm.
So there can be a little jealousy. Before the baby came, we used to be able to go out. We used to be able to make love whenever we wanted to. You were very
Mhm.
spontaneous. Spontaneity goes out the window a lot of the time. And so
Mhm.
we're now shifting into a relationship where we have to plan a little more.
Yeah.
And that's okay, right? It's okay. You might have to plan your dates. You might have to plan your sexual encounters a little more. A lot more planning goes into
Mhm.
life when there's a third, a fourth, a fifth, person in the home.
Mhm.
And so partners can begin to kind of drift apart if they're not both working on the planning. And so it's important for both partners to be working on the planning.
That's
Another source of conflict can be if there's two different parenting styles. And if
yeah.
and if the parents don't really sit down and discuss what their parenting styles is. So I
Right.
recommend to couples, again, before you have the baby, try to have some of these discussions about how you might foresee parenting going.
Yeah, that's
We didn't
good.
have those discussions before, then have them as early on as possible.
Mhm.
These might
And then
sound
have them about 100 more times
I
because
was
you'll
gonna
change your
say,
parenting
well, I was
style with every child.
absolutely. Well, and as the child develops, you're gonna have
Mhm.
different parenting challenges. So
Yeah.
another thing that I recommend to new parents or to parents to be are get familiar with developmental milestones.
Yeah,
Get
that's good.
familiar with what's coming, right?
That's
Stay
great.
ahead of the curve. Don't just wait for the milestone to hit you in the face and then have an argument about how to deal with it.
Yeah, that's
So, you know, get familiar with what are the major developmental milestones and how might we deal with them. How do we deal
great.
with, feeding, what kind of food, the when, the how do we deal with discipline? Obviously it's a huge one.
Mhm.
So in those ways, couples again can feel like there's conflict.
Mhm.
But communication, conversation, planning, time management, and you know be patient.
Yeah,
Be patient.
that's a good word.
Quite the adjustment. Yeah.
That's a great word. Oh, thank you for that. So, in light of talking about, how it affects us and our partners, what about how it can affect us at work? And people have a lot of different work scenarios, but
Um,
it's obviously, a shift there too, for sure.
yeah, some of the things that we come up with our work again are that our time our time management is different. So before you had the baby, you managed your time and it was pretty much yours to manage, and,
Mhm,
and things kind of worked on your schedule because you have control of yourself.
mhm.
Now you might have, control. You think, well, I'm gonna feed the baby and the baby's gonna take a bath and the baby this, the baby that. And right as you're leaving the house, the baby throws up all over you.
Yeah.
So,
Yep.
that,
True story.
right. Or they have, the explosive poop of the century.
Mhm.
So, and you're late to work and now they're looking at you. And so my suggestion is speak with your supervisor slash boss, speak with whoever is basically your direct, you're kind of directly on top of you.
Yeah.
And let them know, you're going to do your best, but you are going to expect that there are going to be times that things are not going to go as planned. Can there be some flexibility? What do we do in those times? How would you like for me to communicate with you in those times?
Mm, it's great.
Don't try to pretend it's not going to happen. And then
Yeah.
if it does happen, don't try to cover it up like it
Right.
didn't happen. Just
Yeah,
again, this is one of those areas where having that communication is key. It's really,
absolutely.
is there a place for you if you're breastfeeding, for example? Is there a place for you to
Mhm.
pump? You don't want to find that out when you are about ready to pump. You need to know ahead of time.
Yeah, that's
Where
good.
can I do this? Is it going to be am I going to be able to do this?
Mhm.
So you want to try to get ahead again, try to get ahead of whatever the developmental milestones are going to be there that you might be attending to. You might need more flexibility at work.
Yeah.
I'm at a point now where my son is 10. He just joined the baseball team. I want to go to one of his baseball
Yeah.
games, once in a while. And so I've spoken with my supervisor and I've said, can I come in a little early so I can leave a little early? So I think the more
Great.
we can discuss with people, the more they'll be willing to help us out with these things,
That's good. I love that advice too of like front loading all that communication before it's an
Yes,
issue. That's
absolutely.
great.
Absolutely. Sometimes we feel shy about doing it, but it really is extremely, extremely helpful to do that.
That is so good. Okay, we got a question from our audience that I am loving. And this gentleman says his name is Joey. Hey, Joey. And he's soon going to be an uncle, which is so exciting. I feel like that first moment when you're an aunt or an uncle before you're a parent is like so
Yeah.
joyous because it's just a special thing. But he's asking if you had any just general advice about, making time to spend with, in his case, his nephew. He's like, it feels like a lot because I have school and I have work, but how would you encourage? I love that he's just even thinking like this, but how would you
Absolutely.
encourage a family member like to be intentional, to set aside time like that?
And that's exactly it. Have, the new parents, one of the things I remember as a new parent, and I have a younger brother who, very much kind of wanted to be the uncle. And so I wanted him to learn to feed the baby as soon as possible. I
That's
wanted
great.
him to learn to change the baby as soon as possible. And he wanted to. And so one of the
Yeah.
things you can do, Joey, is talk to the parents and say, hey, I'd like to learn how to do these things so that maybe one day, if you guys want to go out, you will feel comfortable leaving me with the baby. Because offering to take care of the baby for parents, even if it's, I can take care of the baby while you're here sleeping. I can take care of the
Mhm.
baby while you're here doing laundry or making dinner. So if you can carve out some time to learn to do some of the basic things, which the babies are pretty basic. Again, they eat, they
Yeah,
sleep, and they poop.
that's
So if you
it.
can learn, to manage two of those three things, the third one manages itself. But
That's
even
right.
just showing that initiative, I think is going to be so welcome. By the new parents who, I feel that they're very lucky to have you in their lives.
Absolutely. We all need
Yeah.
a Joey. Everybody go
Yes.
get a Joey.
Yes, and
That's
and
awesome.
and that your niece or nephew, the new baby, is going to be very lucky to have you in their lives. I want you to also become familiar with the developmental milestones so that you know exactly what to expect. As your niece or nephew ages, so that you can have kind of age appropriate activities and interactions with them as well.
That's great. Great advice. Awesome. And thanks, Joey, for your question. All right, let's talk about overwhelm and burnout because it's a real thing. And I think sometimes you don't really know that you're there till you're there. And then it's like, how did I get here? So how
Yeah.
can we manage that to cope with it, avoid it?
Yeah, and this is a tough one because, like you said, Sierra, sometimes we just don't know until we're there and we're crying and the baby's crying and everybody's crying and it's just too much. If you're already there and you're kind of, let's work from the top down. If you're already at the breaking point, then you you're this is when you want to reach out to get some professional help if you can. And the beauty, one of the things that COVID did for us that I think was very helpful in the mental health field is that it finally brought mental health to us, into our homes virtually.
Yeah.
So there's really, nowadays there's like, I say there's no excuse.
Yep.
There's no
Yep.
excuse for you to not have the ability to talk to a therapist. I do sessions with new moms who are either breastfeeding or the babies are right there crawling all over the place. I don't really care. As long as
Yeah.
I can talk to the mom, it's perfectly
Right.
fine. And it's not a perfect session, but it's a session. It's a time when I can help that person. Every therapist will do that. And if your
Awesome.
therapist won't do that, find one who will, you
Yeah.
know?
Yeah.
But so if we're, anywhere below that kind of threshold where we've already felt the overwhelm, then again, take a little bit of time, any time that you can take to do a thing that you enjoy for yourself. And when you have a baby, sometimes, like, I can't tell you how many times I've heard moms say, well, I haven't showered in a week. And I think, well, that is not healthy, just
Hmm.
from many perspectives. And it's like a badge of honor. Like, I haven't showered in a week. No, let's
Mm-hmm.
not do that.
Mm-hmm.
Right. So
Mm-hmm.
our
That's
activities of
good.
daily living,
That's good.
our daily functions. So we brush
That's
our
right. Wash your hair.
yes, we brush our teeth, we wash our hair, we take showers, all those things. Like, do not let go of your basic level activities. Those are our basic things. If you are not doing those things, that's a red flag. Okay.
That's good.
And then we go up the kind of the ladder, right? Then,
Hmm.
you might want to go for a walk. Great. Put your baby in a carriage and go for the walk. Do the
Hmm.
thing that you want to do with the baby. You're
That's
not
good.
going to know if you can do it. You're not going to know what it's like unless you try it.
Hmm.
So do the thing with the baby, you know? And then figure it out from there, instead of not doing the thing because I'm scared that this or I'm afraid that that.
Yeah.
That's where we have those giant bags. We throw all the things in them
That's
and
right.
put them in the car and
Just
we go
pack some extra wipes and
and
you'll get
all of
through
it. Just
it.
do the thing,
That's right.
and um and discuss it with your partner, because here's where you and your partner can work in tandem as well. You can work together to watch maybe your partner can watch the baby while you do go out and
Yeah.
get your hair done or get your hands done or get the massage or just walk around the block or go have a
Hmm.
drink with your friends, whatever the thing is. So
Hmm.
try to work in tandem with your partner so that each of you does get a little bit of time
Yeah,
away
that's good.
from the baby, away from
That's
the
good.
environment of the baby, which
That's
even
good.
just stepping out of the environment can be really, really helpful.
That's good. My husband and I kind of have like a little inside joke, but it's really a helpful coping mechanism for me. But we talk about how when he gets home from work, that he comes in with like a fourth quarter mentality, in a football game,
Right.
like the fourth quarter is what matters. Like we got to finish this thing,
Yeah.
instead of like, all right, I'm checking out, you've been with kids all day, but I've been at the office all day. And, it's so helpful. And he notices if I need like, okay, I'm gonna tap in, you need to go walk to the mailbox or something. Just to
Exactly.
get that moment. Because even just, sometimes I'm literally like, I'm going to check the mail. And he's like, already got the mail. And I'm like, I'm just going to check the mail,
Yes.
but
Yes.
it taken that minute just to kind
Out.
of reset. Yeah.
Yes.
Stepping out.
Yes. Yes.
Good.
For
That's
sure.
great.
Yeah.
Okay, we spoke a little bit about this, but we have a question about regular routines, exercise, that kind of stuff. And I know you said that it's different for everyone and really what's comfortable for you. But if there's just anything you want to add to that.
No, again, I want to say, try to put it back in as soon as you can, as soon as you can. And this, I can only talk, what's healthy. We always talk about, obviously diet and exercise are just healthy for everybody. But
Mhm.
I remember for me, it was, when I had my baby, I lived in Boston, and it was
Oh,
October, early October, and then it started getting really
that's
cold really
crazy.
soon. Yeah. But I would bundle myself up, and I would bundle that little guy like up to his nose and
I
here,
love
and like
it.
wrap him in and take him out because I needed
Yeah.
to walk. I needed to walk. Like each of us knows what our level of activity is. And
Yeah.
also don't have expectations that don't fit who you are, right? If
That's
you were
good.
not a huge exerciser before you had the baby, it's unlikely, it's not
You're
impossible.
not going to become a Peloton champ
Right.
now.
It's unlikely that
Probably.
you're going to be a huge exerciser after the baby. So,
That's
so
good.
your expectations need to match who
That's good.
you are.
That's good.
You know, and here's where I'm going to talk a little bit about social media, and here's where maybe we want to stay a little bit away from social media. Because you know, celebrity X has a baby, and 3 weeks later she's on a red carpet and everyone's like, oh my God,
Amazing.
that's amazing. It's like, yeah, it is amazing and good for her and more power to her, but that
That's
is
right.
that is probably not a good expectation for ourselves.
Yeah, that's
You know,
right.
so
That's good.
so be true to who you are, and try to get back to that routine of who you were
Yeah,
at the earliest possible
that's good.
time frame.
Yeah. Oh, that's good. I feel like we could probably do a whole episode on maternal mental health and social media. I feel like
Oh
there's a
my
lot there.
gosh. Oh my gosh,
I
absolutely. And I
think
felt like
that
I
would
had
be a
to
big one.
yeah, I felt like I had to mention it because for both moms and dads and all that stuff, because it's really creates a tremendous amount of pressure.
Yeah. Yeah.
Tremendous amount of pressure.
No. Well, we've got just a few more minutes. So if you have a question, drop it in. Otherwise, I've got a couple more for us. Dr. Laura Spia, thank you so much for giving your wisdom. Let's talk about, okay, this is a question we hear or a statement when people says, oh, I don't know, how do you do it all? Which I think is such a lie. Nobody does it all.
Don't do it
But
all.
how are we supposed to do it all? Like be able to do it all on our own? Like tell us that we can't, please.
No, and definitely not on our own. No, no,
No.
no. And what you do, so again, I mean, I had to choose, right? There
Yeah.
were things that I had to choose when I knew I had a time frame to go back to work. Would I have wanted to stay with the baby longer? Yes, I did. But you need to be aware of what your time frames are and what you are going to be able to do ahead of time.
That's good.
So many of the problems that we run into with parenthood is because
Mm,
we didn't think about this stuff ahead of time. And I know for
that's
some of us
good.
it might be too late because the baby might be already be there and you're like, oh God, I should have thought about this 6 months ago. But the time to think about all this stuff is when you are expecting your baby. And it really makes so much sense to think about what are the actual expectations for me as a mom, for him as a dad, or for my partner, for two dads, for two moms, for whoever is going to be taking care of this baby. What are the expectation? Is the expectation that I'm going to go back to work? Is the expectation that I'm going to be home? Do I want to be home? Do
Yeah.
I want to go back to work?
Mhm.
So if we do need to do all of these things, how are we actually going to be able to do them? We
Yeah.
can't do everything at 100%. We just
Mhm.
can't. We
Yeah.
can do things that add up to 100%, but we
That's right.
can't be who we were at work and be a new parent and be a friend and be a daughter and be a
Whew.
sexy
I
wife.
feel tired just hearing
I
you say
know.
it.
Yeah,
Yeah.
it's not all happening at the same time. It's not all happening at the same time. And so it's one thing at a time, and we do our best.
Mhm.
Just do our best. Our,
That's
but
great.
we don't do our best all the time. We do our best. And the times we're not doing our best, we are trying to do our
Mm.
best. We are trying to do well at this thing, you know?
That is
So
so good.
keep trying, and set your expectations where they need to be. Do not set the
Mhm, mhm,
expectations someplace where you are not going to be able to reach them, because you're just setting
mhm.
yourself up for disappointment and stress and anxiety.
That's right. And I have, I say a little bit older kids. My oldest is 5, but to add to that, we're modeling so much for our little people
Yeah,
too, and I
yeah.
think we would never put that kind of expectation on our child, but if they watch us just juggle all the things,
And the whole,
and
I
there's,
mean, one of the
yeah.
expressions, I hate that expression, super mom. I
Hmm.
I think that is such an awful expression.
Yeah.
I
Yeah.
all moms are super, and
That's
all
right. I was gonna say
moms
everybody
are
is.
like,
You had a baby. You are a parent. However, you had the baby, adoption, whatever, you are a parent. That's great.
exactly. And
That's
so
great.
forget about all that stuff, really.
Oh, this is good. Okay, our time is rounding out, but I'm gonna rapid fire a few more questions. All right, let's talk about breastfeeding. That we could do a whole episode on that, and I think we have. So go look in the archives. But what about if breastfeeding is difficult? That can be a mental challenge.
It can be. So I'll say a few things. It's not something that happens equally for everybody. It is different for every single person, and it is different within babies, right? Even if you had
Mhm.
within families. And so with this, I will say, do your best. Do your best. It can be painful. It can be wrought with guilt. This is, I think, one of the things that causes the most amount of guilt for
Mhm.
moms that want to breastfeed, but whose bodies are not really cooperating with the breastfeeding.
Yes.
This is one of the major sources of
Mm.
sadness, anxiety, and guilt.
Mm.
So your body is going to do what it's going to do. You get to decide how much effort you put into this. You get to decide. Don't let people decide for you. Don't let the medical establishment decide for you. You decide for yourself.
That's
And
great.
I think that that is probably the best I can say about that.
Awesome. It's good. Good word. You spoke a little bit about this earlier, but just about the possible changes with intimacy as a new parent. Anything you want to add there?
Yeah, don't give up. What I want to say is keep trying new things. Don't give up. If you're, let's say, if one of the partners isn't trying, then it's not going to be happening.
Yeah.
So it is important for you guys as a couple to realize that one of you has to put yourselves out there to kind of continue to do the ask, if you will.
Hmm. Hmm.
The changes happen, but intimacy is really, it is important. It's an important part of the couple. It's what got us in this mess to begin with. So it was very important before the baby came. And I encourage couples to prioritize it after the baby's here. The baby's not going to see you. The baby's not going to hear you. Even if they hear you, they're not going to know what the heck is going on. The baby doesn't know what the heck is going on. I have couples tell me, we can't in the same room. We can't in the same house. What if the baby hears us? But
Like, I'm pretty sure your infant is unfazed.
it's okay. It's okay.
Oh, that is fun. No, that's good. Don't give up. Okay, finally, and you spoke a little bit about this too, so maybe just tie a bow on it for us. But we said, parenting is truly a lifelong journey, and our parenting style is going to be developing the
Yeah.
whole way through.
Yeah.
So as we, have those opportunities to clash perhaps with our partner or others that are involved in raising our sweet little ones, yeah, what advice do you have for people walking through that?
Maintain the dialogue, keep an open mind, because this is a lifelong learning process. We will not stop being parents. And so this is one of those things where we get the opportunity to trial by error. Don't get stuck on any one thing. Stay flexible, stay fluid, and stay curious.
Yeah,
Stay curious, and
that's good.
stay open to communication.
That's great. Oh, that's so great. Oh, Dr. Laura Ospina, thank you for joining us again for
Oh,
Parental Guidance. I really do encourage all of those of you who are listening to check out jacksonevents.org and do a deep dive into the archive, and you'll find the episode that we did with her previously. I know that will encourage you as well. A couple announcements for you. So actually this weekend, so tomorrow's Friday, so Saturday and Sunday, Parental Guidance is going to be live at 11 a.m. at the Children's Alley at Miami Book Fair. So the largest book fair in the country Miami has. This is quite the exciting thing, the book fair. So 11 a.m. both on Saturday and Sunday, Parental Guidance will be live. The session is going to be on mindfulness, followed by a yoga session for kids. So if you're out at the book fair, 11 a.m. this weekend. And then otherwise, mark your calendars to join us in 3 weeks on Thursday, December 8th for our next episode, which will be Parental Guidance, understanding when do I go to urgent care versus ER, and it's going to be in Spanish, fully in Spanish. So I will bow out of that one because my Spanish will not be proficient enough to lead you, but we're going to have a great host. So join us again in 3 weeks, Thursday, December 8th for Parental Guidance in Spanish. Accidents happen. Having the knowledge of first aid skills and emergencies and what to do is important. So join us then to learn the difference between an urgent care center and emergency room visit and what would be best for you. So that'll be fully in Spanish. And then finally, just a reminder just to check out jacksonevents.org, and you can listen to the previous ones. And this one is recorded, so it will get sent to you if you are on the email newsletter. Otherwise, you can find it there in the archives in about a week. So if you want to screenshot this slide right here, some great resources, additional, reading and books that you can do that Dr. Laura Spina has shared with us. So again, thank you for joining us and sharing your expert wisdom with us tonight.
thank you so much for having me. It's always super fun. I hope this was helpful for everybody that was here for it with us.
Absolutely. I know I was encouraged. I know our audience was too. So everyone have a wonderful evening and a great weekend. Thank you for joining us.
Bye.
Bye.